So let's talk about the oncogenes and how cancer is the flip side of osteoarthritis. And you might be a little confused by that statement, but hear me out. So you have two growth control genes, or your cells do at least. And if those genes are intact, the first one says, if you're pushed on, die. That way, if there's not enough room for something, cells will just die to make sure that we're not overgrowing a space. Obviously, if that's broken, such as it occurs in a cancer cell, that cancer cell will push on other cells around it, feel the push, but not do anything about it, whereas the other cells will die. Now that leaves more room for the cancer cell, and the cancer cell will continue to spread and grow. So the flip side, in osteoarthritis, a cell experiences pull. And so that oncogene turns on and says, if you're pulled on, grow. And any bony prominences, such as occur in normal places in your body, kneecaps, knobby knees, etc., your ankle bones, any of those are places where there's been excessive pull. So the more athletic or active someone has been, is visible on their body because you can see they have knobbier knees and bigger enlargements of their bone, prominences of their bone. So the problem is that when you have that, at some point, what that also means is that there's an abnormal pull in the body or on a structure, such as occurs at a joint when you get a bone spur. So this has a little something to do with bone spurs. And so bone spurs are with a capsule or a tendon or a ligament insert in or near or around that joint, and there's a chronic pull in that place. And so that oncogene, the growth control gene, kicks in and says, hey, you're being pulled on. Grow to alleviate the pressure. That becomes problematic, though, because now you have a bone spur overgrowing a joint line, and that can also cause more pain. And the inflammation from that arthritis, or osteoarthritis, causes irritation in that shoulder or knee or whatever it is that you have. So you want to think about that when you're experiencing pain or dysfunction, that it can be a natural process. Now, here's the kick. Why do you have abnormal pull in that area? Well, it's important to consider, if I have abnormal pull out here at my AC joint at my shoulder, it could entirely be the joint on the opposite end of the bone. It could be the joint at the other end of the bone, the sternoclavicular joint, or it could be ligaments along the path of the collarbone or clavicle, or ligaments such as the acromioclavicular ligaments. The acromioclavicular ligaments attach, right? There's a bony prominence here, your coracoid, that sticks out from the shoulder blade, and there are specifically 3 ligaments that come off of that to your clavicle. If you've injured your shoulder in the past where you've caused inflammation in there, and what will happen is you'll break tissue, you'll tear tissue, much like you do when you work out. That's why your muscles swell, is you've also freed up protein because you've torn a certain amount of tissue. Now, protein that was on the inside of the cell is on the outside of the cell, and that causes an increase in oncotic pressure from protein, free protein. So water, fluid gets sucked into the area. Now, the problem with that is that, first at the gym, you're thinking, I'm all yoked up here, I've got larger muscles. However, in a ligament, that's a problem because now that long and thin ligament that was malleable becomes short and fat, and it takes up motion and won't let the structure go back to where it was, thus creating a pull at, for example, your AC joint. And then you will get a bone spur, a bony prominence, an abnormal bony prominence that will cause inflammation and soreness in the area and may overgrow the joint and cause further degradation of the joint and pain, which is one of the reasons that oftentimes the acromioclavicular joint is actually snipped right there. Okay, so an acromioplasty. But that's something you should understand when you're having pain or a problem somewhere in your body. You want to understand that process. That's why knee pain or knee inflammation or a bone spur somewhere is not typically due to that spot. It's in response to something else causing a push or pull throughout the body. And if you understand that, you can find the source of your problem, the why of your problem, and not just put a Band-Aid on the problem or treat the symptoms. I like to get to the bottom of why is there something there? What is the why? What is the ultimate cause? Not what's the local cause or the easy answer is this is what the x-ray, the MRI, or the 6-inch box on the shoulder shows. That problem can be clear over here or in a structure you might otherwise not even suspect. So when you're getting treated, make sure that all the angles are